Hi, so with the exam season looming, I'm getting lots of questions from students about 2-week wait criteria. So I thought I'd do a little video and help you understand how to assess and refer patients appropriately for those that you think fit the 2-week wait. But it's also really important that we recognise sinister or concerning features which fit the 2-week wait criteria. And that's important for our patients to manage them appropriately, but it's important that we don't stop there. So we also talk about things like red flag symptoms or signs, and we mustn't forget about patients that present with subtle signs or symptoms that may demonstrate something quite sinister. So the key 2-week wait criteria includes things like mouth ulcers that are not healing, neck lumps that are persistent, unexplained hoarseness or sore throat or difficulty in swallowing. And all these things are outlined really clearly in head and neck cancer guidelines. And they're very broad terms, so it's really important that you use your clinical judgment and intuition, but also think about these other red flag symptoms that may arise. So other red flag symptoms that we talk about include a non-healing tooth socket. And remember that a dry socket is self-limiting, so that will get better. So a socket that's not healing over 6 to 8 weeks is something particularly sinister. Also, numbness of no obvious cause, particularly in the lower lip and chin. There's no obvious dental cause for that, or trauma or treatment. Patients that present with unexplained tooth mobility with no obvious periodontal cause is a concern. And also patients that present with bleeding gingivae, bleeding from the mouth generally, or the throat, or the nose, which is called epistaxis. They're all kind of things that we need to be quite concerned about or raise an index of suspicion. In addition to that, don't forget about the things that we call B symptoms. So those patients that present with things like night sweats, unexplained weight loss, or fever, these should be taken seriously because they often demonstrate an underlying systemic problem and they're clues that we shouldn't ignore. So the summary is use your clinical judgment. The guidance is there as guidance, but also if you think something is wrong, and instinctively you think it's wrong or it doesn't feel right, then you're probably correct. And then you should think about an onward referral to the appropriate practitioner in the appropriate time frame. So good luck for those who are studying exams, and I hope that helps.